the conversation this morning for this Washington County Board of Commissioners COVID-19 Town Hall. But before I get started with my opening comments, I would like to pass it to a staffer at Washington County, Christina Barboza, to share some information for our Spanish-speaking fellow residents that may wish to avail themselves of the Spanish channel. So, Christina, if you would, please.
Thank you. Gracias. Buenos días. Gracias por acompañarnos a hoy. Hay interpretación en español disponible. Si gustaría escuchar esta audiencia pública en español, vaya a la esquina inferior derecha de su pantalla. Ahí encontrará un icono de globo. Haga clic en el icono y seleccione español. Será dirigido automáticamente al canal en español. Si desea hacer una pregunta, puede hacerlo en español y su pregunta será traducida al inglés. Tendrá 2 minutos para hacer una pregunta o hacer una declaración en voz alta. Si lo desea, puede utilizar la función de chat para enviar preguntas por escrito en español. Gracias.
Gracias, Christina. Christina is just one of the many staff and elected officials from Washington County joining you this morning to share information about an issue that is critical for all of our well-being. Again, my name is Marcus Mundy. I'm the Executive Director of the Coalition of the Communities of Color, and we are a member of the Washington County Racial Equity Collaborative. And again, I'll be facilitating the conversation this morning. We welcome and thank all of you in attendance this morning who have taken the time to join your Board of Commissioners and their team to speak about a very important discussion concerning the COVID-19 pandemic. Your commissioners and Washington County staff care about their residents' well-being and are going to share as much information as they have to date. While Washington County has many, many issues on any given day, including today, today's session will focus exclusively on the pandemic and public health and how our county can best prepare for the coming months so that all of us who are trying to live and work and educate our kids and worship in Washington County can be safe. Today is all about us, the residents of Washington County. It's a very simple program about a very complex issue. So I'm going to take some time now to just give you a couple of logistics. You're going to hear from the chair of the Board of Commissioners of Washington County. Your other 4 county commissioners are all in attendance on this call, and they will also be fielding some of your questions and answering some of your questions, but they are all 5 of your commissioners are in attendance today, as well as subject matter experts from their staff and lots of other county staff to support your questions and answers. Another piece of logistics, we have American Sign Language interpreters for those of you all who prefer that. We have closed captioning for those who prefer that. And again, we have the aforementioned Spanish channel that Christina just shared with you, and she will give us a couple of more updates throughout the course of our conversation today. Round about 10:30, after you hear from your county chair, Catherine Harrington, we're going to get started with our Q&A. I said it was a very simple program. This program is meant to hear from you, the residents of Washington County. So your commissioners have left the bulk of the time to answer your direct questions about what is going on with the pandemic in your county. So that is it. That is it. So what I would like to do at this point is ask Christina again, because some people may have joined late, to share the information about the Spanish language channel. And then immediately thereafter, we'll hear from our chair, Catherine Harrington. Thank you, Christina.
Buenos días. Gracias por acompañarnos hoy. Hay interpretación al español disponible. Si desea escuchar esta audiencia pública en español, vaya a la esquina inferior derecha de su pantalla. Ahí encontrará un icono de globo. Haga clic en el icono y seleccione español. Será dirigido automáticamente al canal de español. Si desea hacer una pregunta, puede hacerlo en español y su pregunta será traducida al inglés. Tendrá 2 minutos para hacer una pregunta o hacer una declaración en voz alta. Si lo desea, puede utilizar la función de chat para enviar preguntas por escrito en español. Gracias.
Gracias, tal vez, otra vez, Christina. And now, without any further ado, the one thing I will say is I want you all to please be thinking about the questions you're going to ask. Again, we're going to have a good time to answer your questions, and I will update you on how to participate in the Q&A. There's a Q&A function. There's a raise your hand function. I'll get into those details after we hear from our chair. So thank you very much for listening, and I'd like to introduce the board chair of your Board of County Commissioners, Catherine Harrington. Chair Harrington.
Thank you, Marcus, and good morning, everyone. I'm so delighted that we are gathered together as a Washington County community today. I am joined by your 4 district commissioners, Commissioner Roy Rogers, Commissioner Dick Scouten, Commissioner Pam Treese, and Commissioner Jerry Willey. Thank you for joining us today. I'm going to provide a short information overview, and then we'll turn it over to your questions. I also want to thank the many Washington County staff who have done the work to make this town hall possible today, as well as our interpreters, our translators, and our staff subject matter experts, because we want to make sure that you get the best available information that we can provide. We have a short slide presentation to use together, if that could be projected. There we have it. Next slide, please. First, I'm going to dive into some information about where the state has made some changes to how we track the spread of this terrible disease in our community. We're now in our 10th full month of living with this deadly virus, and we've learned a lot since we first started on this journey together, and we've learned a lot since our first COVID town hall back on May 11th. So the governor and her team have defined a new guidance chart to track the spread of this disease. You can find all of this information on the state website, coronavirus.oregon.gov. And for those of you who may be watching from your computer this morning, if you go to that website, you can follow along. Once you get to that main page, either at the top, click on What's Open in My County, or on the bottom of the page, Current Status and Guidance. And then on that next page, click on View All Guidance, and you'll see this chart. So what this chart enumerates is, on the left-hand side, different kind of activities that you and I partake in our daily and weekly lives. Right now, the presence of this disease and community spread has us in the most right-hand column, extreme risk. And then you see further over to the left, high risk, moderate risk, and low risk. What's important is that this is all based on the risk profile of the presence of this disease in our community. So I'm not going to spend any time going over each of these categories, but rather I wanted to make sure that you know that we've learned more about the effect of this virus. The state and our health experts, epidemiologists, public health experts have learned a lot more about this brand new virus and have put in place new protocols to help support us in our lives and to keep us as safe as we can be as we go about our daily lives. Next slide, please. So you can see over on the left, there are different types of activities. Next slide, please. And this new metrics system will be with us through a good part of next year. We have a lot of hope now. A vaccine is being deployed. We won't have as much as we want as soon as we want it, but it is available now. and will be deployed through our community. And we'll talk a little bit more about that in a few more slides. Next slide, please. So this slide is just showing you a snapshot of where we stand today as a community and how that spread, that presence of the virus in our community stands up against this model. So unfortunately, you can see on the right-hand side through this chart, the presence of this virus is widespread in our community. Though the news just yesterday from the governor and our state experts is that we all did a good job of limiting our socialization over the Thanksgiving holiday. Thank you, thank you, thank you. I know I join my colleagues in not wanting any of you to become a statistic. We don't want you to suffer with this sickness, and we certainly do not want you to be debilitated or die in the days ahead. So we thank you for your efforts. We know it's hard. It's hard on us too. We've curtailed visiting with friends and traveling, but it's for the best. Now that we have some good news about the fact that a virus will be deployed in our community in the coming weeks. I mean, exciting. As we go into 2021, we're hoping that all of us in Oregon will be vaccinated by the end of the summer and into the fall. So we do have great hope ahead, but now is not the time to let our guard down. We need to get this curve turning the other way around. Next slide, please. So let's talk about that vaccine. Our national government, our federal government has defined a strategy for the deployment of the limited supply of the vaccine. The manufacturers are going to be making as much as possible. So what we need to do is make sure that we reduce the spread of the virus, preserve our healthcare system, and get our kids back to school. I think we all agree on those two goals. So for the deployment of the virus, the plan is to make sure that all of the healthcare workers that we rely upon in case we're sick or if we're living in long-term care, that they get vaccinated first, as well as the residents of these long-term care facilities. You're going to hear more about the deployment of the vaccine in the coming weeks through phase 1 and phase 1A, phase 1B. So it's just a matter of time before this vaccine is deployed. So trying to make sure that the most vulnerable members of our community get vaccinated first. Next slide, please. So here you can see the continued rollout so that as there are more vaccines, the greater population of our community will get vaccinated. One thing that I had to learn last week in the hopeful news of the vaccine, they are 2-dose vaccines. So it's not enough to get that first shot. We have to follow up and get that second shot to make sure that we have as much protection as possible. And it's not enough to get that first shot. If you only get a first shot, you can still contract the virus and you may still be contagious to others. So please be sure to follow up. Next slide, please. All of this information is publicly available. We're just trying to do our part to make sure that you become more familiar with it. As you can see here, this is just a timeline that shows how the 2 most promising vaccinations have just received the okay through the Federal Food and Drug Administration, and the manufacturers are deploying the vaccinations out to our community starting on Sunday. It's a complicated process, but we hope to get our hospital workers, long-term folks in long-term care facilities vaccinated as quickly as possible in the remaining weeks of December and into January as possible. Listening to the governor yesterday, we hope to have 140 or expect to have 147,000 doses of the Pfizer and Moderna vaccinations or vaccines by the end of December. And we know we have over 300,000 healthcare workers here in Oregon. So as I said, we won't have as much as soon as we want, but we're going to press on. We have about 4 million people who live here in the state of Oregon, and we need 3/4 of our population to be vaccinated before we can really get back to normal living without having to wear masks, physical distancing, and limiting our socialization. So in the coming months of 2021, we cannot let our guard down. We do need to still practice safe living, but we're seeing the light at the end of the tunnel, ladies and gentlemen. We're getting there, and that's a really good sign, a hopeful sign. So what a way to kick off a new year. Next slide, please. So we're hoping by the end of June, by the end of spring, there will be enough vaccinations for every Oregonian. The news as of yesterday is that that thinking is evolving because there still isn't a clear deployment strategy across our nation. I just read an article this morning that we're hoping by the fall. So it's fluid. But the point is, hope is there. We're getting there. I know I would love to have everyone vaccinated by summertime, and that we can get our kids back into the classroom. Let's all do our part. And to reinforce the other key takeaway, they're 2-dose vaccines. So I know you're relying upon me to get 2 shots, and I'm relying upon you to get your 2 shots. Next slide, please. So here we are at the doorstep of another holiday season. And yes, it can be a joyous holiday season, but first and foremost, we need to make sure it is a safe one. So once again, just like with Thanksgiving, we're being asked to limit the number of people that we come into contact with. So please just stick to your immediate household. Take advantage of all the internet capabilities that are available to us and meet virtually with your loved ones. Limit all of your social gatherings. I know I'm a broken record on this, but it's really important. Wear your masks, watch your physical distancing. Please, please be safe. I have heard reports of our shopping malls being crowded with shoppers. Yes, folks are wearing masks, sometimes not always properly and exposing their noses, but please do what you can to be safe. You are important to me and to my colleagues. We want you around. We want you to see the years of 2022 and beyond. And as the latest communication has told us, our pod, our safe group, our pod of exposure is bigger than any one of us can imagine. Next slide, please. So here I said it would be a short information session. Our staff has reassured me that this short slide presentation and a summary of all the Q&A, your great questions and answers will be available to all of us publicly after this meeting. As you can see here, there are ways to get out safely and take in some joy from the holiday. I know that I've been out and about driving through and walking through different neighborhoods to take in the various light displays. So that's it presentation wise, and we very much look forward to your questions and want to make sure that you have the benefit of good information. You can pose your questions to any of us or just generally, and we'll do our best today to cover your questions. So I'll turn it back over to Marcus to help us through the Q&A process. Thank you.
Thank you very much, Chair Harrington. And before I walk through the logistics about this next phase, which will be very brief for me walking through the logistics, I will ask Cristina Barboza one more time for anybody who would prefer to hear this presentation in Spanish. Cristina will give instructions on how to join the Spanish channel, and then we'll jump back in with the next phase.
Buenos días, gracias por acompañarnos hoy. Hay interpretación al español disponible. Si desea escuchar esta audiencia pública en español, vaya a la esquina inferior derecha de su pantalla. Ahí encontrará un icono de globo. Haga clic en el icono y seleccione español. Será dirigido automáticamente al canal en español. Si desea hacer una pregunta, puede hacerlo en español y su pregunta será traducida al inglés. Tendrá 2 minutos para hacer una pregunta o hacer una declaración en voz alta. Si lo desea, puede utilizar la función de preguntas y respuestas, Q&A, para enviar preguntas en escrito en español. Gracias.
Gracias, Cristina. Three very quick things. One, as the chair suggested in her comments, we're not here today to debate the existence of COVID. And if any of your questions are associated with that, those won't be answered today. The chair and all 5 commissioners do believe that COVID exists. And as you can tell from her slides, they are focused and dedicated to resolving this issue for the county. Number 2, I think I mentioned it earlier, but we're going to speak about COVID and public health specifically today. So please tailor your questions to that. Your commissioners want to get this information out about COVID-19 as widely as they can. And so please focus your questions on that. And then the third thing I have is that it's about the questions. I hope you have developed many questions as your commissioners, again, are very anxious to share with you. So the questions have come in 3 different ways also. We had some pre-questions that came in. People emailed some questions, and there was a pre-survey that was done. And in about 30 seconds, I'm going to ask Elizabeth to share some of that information with me. And then the other 2 methods are to raise your hand. And I think Cristina or the Spanish channel team has shared with you how to raise your hand. You can click a function on your screen and that'll lift up your hand, and then staff will lift up your questions in the order that they came in if you want to be heard. And then the second thing is if you want to type in a question in the Q&A section, that can be done. And there are staff looking at all of those questions and we'll be lifting them up. And what I'm going to do as facilitator is I'm going to go from raised hand to Q&A to pre-questions. I want to get as many questions in as possible. The last thing I will say before I ask Elizabeth to give me the first question is that when you raise your hand, and if you are providing verbal testimony, not testimony, but a verbal question or comment, we're going to limit your comments to 2 minutes, much like we do at a normal commission meeting, just because we want to hear from as many of you as possible. So that's it. So I'm going to start off now by going to Elizabeth and asking her for the first question that she has.
Great, thank you, Marcus. So from the pre-event survey, a question was, where are positive cases coming from? Industry, business, in-home social gatherings, and what's the situation of bed availability in the hospitals? So I'll go ahead and read the answer from our subject matter experts, and then the board can make comments or add on. There is significant community spread, so we're seeing COVID cases in many work settings and social gatherings. That's why the importance of taking all precautions, wearing a face covering, physically distancing, and washing hands frequently. The hospital bed capacity is very limited. Some area hospitals have begun to limit elective surgeries. Additionally, planning has been undertaken to be prepared for further changes if needed. One of the biggest concerns is having enough staff to provide the care. So I'll turn it over to the board if you want to add other comments or?
Wow, that answer came out really fast. But I think the subject matter expert information is just sharing with us that we're seeing a lot of people still socializing with one another. We're seeing workplace outbreaks, and it's a real challenge on all of us. It's a tough situation. And our hospitals are really taxed at this point as well. So that's why all of us need to do our part, redouble our efforts. We know it's hard, but it's for the better. We have a lot of people dying. We've also learned through storytelling that there are many folks who may be really sick for just a week, but then it takes them another 3 weeks before their energy levels are back to more normal.
6 months.
Then there are other people who are experiencing it for a long haul. Through the press conference with the governor yesterday, such an individual was highlighted, and that story is available on social media and her video. And she's not out of the clutches of this virus yet. So that's why we want each of us to do what we can to limit our exposure. We on your county commission are working from home. All of our meetings are virtual. We've been doing this for a month now, and we're going to keep doing it until we are out of extreme risk. And I want to make sure to turn the mic over to my colleagues as well. Commissioner Scouten?
Just a quick comment. Yeah, the term that's being used to describe people with these longer term symptoms after the worst is over are the long haulers, and there's more than a few. There's a growing number of them. It's a significant number of folks. So, one more reason to be careful.
Thank you, Commissioner. Elizabeth, I'm still going to go back to you. I hope you have a few more questions that came in earlier.
We've got lots and lots of questions on this side. So anytime you need me to, I'm happy to jump in. So from the pre-event survey, someone asked, how are the COVID restrictions being enforced in Washington County? The answer is Washington County public health staff provide technical assistance to all businesses in Washington County so that they can understand the current executive orders and how to implement them. If anyone has concerns about a business, they should speak with the manager, but they can also send a concern to us at EOC, and I will put this in the information as well, at EOC-COVID enforcement at co.washington.or.us, and I'll say that again, EOC-COVID enforcement, one word, at co.washington.or.us. Staff will contact the business. If we receive multiple complaints, we will also conduct a site visit, and if necessary, refer a business to state agencies that can do enforcement activities.
Thank you. All right. That seemed like a pretty comprehensive answer, and doesn't look as if the commissioners are clamoring to add something to that. And so I will ask at this time, I think it's Chuck or Marcus, do we have any raised hands with questions from people that want to be heard?
We do. There's a raised hand in the chat from Dale, and I will go ahead and allow him to unmute himself.
Thank you.
Start a timer for that.
Am I unmuted?
You are.
Hi, I'm Dale Feek, Chair of the Washington County Citizen Action Network. I've heard, and I think it's true, that some industries, some of the larger ones in particular, have their employees sign non-disclosure agreements between them and their employees, in which then they aren't allowed to actually talk about issues related to COVID in their environment and share it with other people and you as county commissioners. So I'm wondering how you as a county commission can address that problem and make it so that employers understand that they're not doing the public a favor in having those kinds of non-disclosure agreements with their employees. Thank you.
Thank you, Dale. Is there a commissioner that wishes to?
Well, I think the only comment I'd make right now is that's a good legal question to ask county council. And I would wonder about the legality of that and how, if we were to ask questions and have an opportunity maybe to hear from employees, if that's in fact the case, hear from employees, at least on the side or in some sense of confidentiality, and then at some point go to the management and talk to them. But I'd love to hear, get an opinion from county council about this, about the legality of non-disclosure agreements with employees. And of course, I'd like to know more about whether that's factually true or not. Though I suspect that it might very well be.
Thank you very much, Commissioner. And
I would approach this from, thank you, Marcus. I would approach this from a different angle, and that is the Oregon Occupational Health and Safety Authority, OSHA. All workers are protected, and if employees are experiencing problems at work with the protocols being followed or other concerns, they can contact OSHA. Also, because of the way our healthcare system works during a pandemic, if employees for any company, if any resident here in our state gets a positive test, the labs that perform that test are required to submit that information to the Oregon Health Authority. So our public health team is seeing the data about people being sick and are able to, from that data, to explore outbreaks, and we're including workplace outbreaks. And our staff works with a lot of different employers to help educate them and to help them on solutions so that they can continue to be in business, but to do so safely, to limit the exposures and the difficulties and get back on track. So while the legal question is an interesting one, I would approach this from the sure that they're able to do their job safely. And so that's where we have the EOC compliance email that was shared earlier, plus OSHA has a means for people to submit information and get support.
Thank you very much, Chair Harrington. Marcus, I'd like to ask if someone else was ready with their hands raised to hear from another resident.
There is another hand raised. Hector, you can go ahead and unmute yourself.
Thank you.
Yes, good morning, everyone. Thank you for this great platform. Regards to the last comment, the best thing that we can do is evidence, written evidence. If we can get a copy of that non-disclosure agreement, we'll get them some help, either as Commissioner Harrington said, through OSHA or BOLI, Bureau of Labor and Industries. That just got to be protected under Whistleblower Act or something. So we need the evidence. Get us a copy of that so we can have something to work with. Thank you.
Thank you, sir. I would like to ask at this time for some of the Q&A questions. I think staff has had enough time to group a couple of them. So Elizabeth or Latricia, I'm sorry, I should remember which is going to be doing that. Elizabeth.
That's okay.
Okay.
So a question. I want to understand more about the risk of exposure in our own homes. Answer from our subject matter experts. There's a very high risk of transmissions in a home where someone is ill with COVID. We encourage that the ill individual is separate if possible in a separate room and use of separate bathroom. That only one family member cares for them, and that everyone wears face coverings and are vigilant about hand washing and disinfecting the home. I know there's a few more questions that have come in.
Could I add to that, Elizabeth?
Absolutely, of course.
Our healthcare team has put together information packets as well as videos on how to live through the experience of members of our household being sick. So please check out the social media site for Washington County as well as Washington County Health and Human Services. And on the Washington County webpage, there's a COVID button for getting those documents, for seeing the videos, and also reaching out. If you need additional assistance, 211 is a resource for you, whether you need support to get groceries and so forth. So thank you.
Thank you, Chair Harrington. And Elizabeth, you said you had a series of questions, so we would like a couple of more of those that have come in through the Q&A.
Absolutely, and if I could, we've had a few questions about what's been done for the business community in Washington County. So rather than reading our answer, I thought I would just turn it over to Commissioner Treese and Commissioner Willie, who maybe can give us some information.
Hi, Elizabeth. Yeah, this is Commissioner Willie, and I will give a quick recap of what we've been doing for the business community, specifically focused on our small minority businesses. And lately, we've even got that more focused on our hospitality industry. But let me begin by giving a little bit of an overview of Washington County. We have 13 cities in Washington County, but we also have 250,000 people who live in unincorporated Washington County. So that means they are not under the jurisdiction of cities. So our focus has been with this CARES money is to make sure that we work with our cities and provide them with money, as well as focusing on our unincorporated area. So that's where we started. We had about 15 million initially allocated for small business recoveries. $10 million initially went out to cities and our unincorporated area in the focus of grants, and we had a small loan program in the first round as well. We also had the cities had got out ahead of us, I think, before the CARES money came, and had put about $2.5 million of their money on the street, helping small businesses and minority-owned businesses. So we reimbursed them, which I believe they turned around and did another grant offering. So they didn't keep that money, they kept that money going. We also set up what we call business recovery centers. And we invited our 3 of our local chambers, and then in Forest Grove, Adelante, Majeras, to help us get the word out, get PPE out, free PPE, I might add, plus sanitization, other things out to our business community, and help us with a program to promote that, make sure the small businesses knew where they could get these items for free, and help them stay safe and possibly stay open. And then recently we have the state allocated $55 million. We were allocated about $5.8 million of that. And we're working again with the cities and other organizations to make sure that we reach out specifically for our hospitality industry. And that's our hotels, that's our restaurants, organizations that have been closed because of the latest freeze. So we are trying to be very strategic in helping those businesses make it through the holiday season, and certainly the last surge of positive cases. And we're trying to do our very best to reach out specifically again to our BIPOC and small and minority owned businesses. So there is programs that are open right now. The county has one that's open until Sunday. So if you have a small business, please go to our website and look for that and get an application in. And there are, if you live in a city, there are also several cities that have these programs available. So that's what we've been trying to do from the standpoint of our business CARES allocation money. And we've been working really hard. Commissioner Treese and I have been overseeing a group that's been focused on that. And we've really enjoyed working together and having, I guess, the ability to get some money out into our small business community. So Commissioner Treese, I'm sorry, I probably took all the time for that, but if you have something else you'd like to add, please jump in here.
Thank you, Commissioner Willie. I think you did a good job of covering the major aspects. There's one thing I'd like to point out, and that is that the commission, the county, has been aware of this need even before we got the CARES money. We allocated $1 million early on, even before, like I said, the feds came in with dollars, and that's when our team was formed. That was in April. So, and at that time, we also became definitely aware of the needs around daycare. So daycare has been included in the overall picture of the CARES funding. Daycare is something that we need to be addressing, but it's also a business issue. So I want to bring that up as well, that it's part of the whole picture. The other thing that I would like to say is that I'm very sensitive to the fact, and I know the rest of the commission is as well, there's never enough money. There's never enough money, but we're doing the very best we can with the resources that are available to us from the county, from the state, and from the federal level. So, take advantage of what we can do, and please continue to give us feedback. Thank you.
Thank you, Commissioner Treese. I would like to swing it to Marcus Ford to see if there's any resident who wants to be heard again this morning with a raised hand.
There are no current raised hands.
Oh, very good. Washington County, normally more vocal. All right. Then I will ask Elizabeth to either some of the pre-questions or some of the Q&A questions, if you would, please.
Absolutely. First, I'll say it's fast and furious over here in the Q&A. And I'll also say I've gotten a few comments that I was speaking too quickly. So apologies. I will do my best to slow down. By the way, this is me slow. So we have a few questions about vaccine availability. So I'm going to try to bunch them together. And if the board or other subject matter experts want to jump on, please do. There's a question about vaccine distribution based on positivity rates, and a question about when do you think healthy 30-somethings will be able to get the vaccine? So to the first, vaccine distribution in response to positivity rates. Once phase 1 and phase 2 priority populations have been vaccinated, populations disproportionately impacted by COVID will be prioritized. In Washington County, we are working with our partners to prioritize Latinx community and other disproportionately impacted populations. That leads into the when do you think healthy 30-somethings will be able to get the vaccine? Vaccine distribution is expected to take several months. Our current understanding is that the general public may have access to vaccines in late spring and summer. So that's June, July.
If I could add, now that we know that there are vaccines, it's still very early. I heard a talk with one of the OHA, Oregon Health Authority experts yesterday, and she made it clear that it's still early in our knowledge with regard to the safety protocols, as well as early in our knowledge about the efficacy of these vaccines, meaning we know that there are 2 approved vaccinations that are upwards of 90% effective, but they don't know the full range of side effects and interactions with various medical conditions. But nonetheless, we don't want to wait any longer to deploy these approved vaccinations because it will save lives and reduce the harm that our population is experiencing and has been for several months now. At the same time, we don't yet have clear distribution details. One of the vaccinations requires cold storage, and so we are at the very first stage of understanding, of experiencing what that distribution is going to take. They start shipping tomorrow. So as anxious as I am to know, so what month can I go get vaccinated? And I'm very anxious for everyone in our community to know that those details just aren't known yet. What has happened is that advanced equipment, syringes, gloves have been deployed. All of our hospital systems have deployed appropriate personnel from all of their departments to try to staff up the deployment of the vaccinations. We've heard it on the news, CVS and Walgreens, but we are now at the first step of putting those plans into action. It requires all of us to be patient, to keep our guard up, to keep wearing our masks, washing our hands, and watching the number of people, limiting the number of people we interact with. And you can rest assured that as more clarity is known, sure, the state and the governor will have press conferences. We'll be sure to get information out to you, which could be more town halls in the early days, in the early weeks and months of 2021. We want to make sure that you have good, reliable information. You're asking great questions. I can relate to many of them.
Thank you, Commissioner.
The only comment I would add to that would be that I'm glad that our staffer Elizabeth Mazzaro Myers mentioned the Latinx community. They're well less than 20% of our Washington County population, but well over 40% of the COVID cases. My best understanding so far, the studies would indicate that that's not anything to do necessarily with anyone's background or ethnicity. It has to do more with occupational exposure. Nonetheless, we need to be mindful of that group among a couple of other very critical groups.
Thank you, Commissioner Scout. Carry on, Elizabeth.
Great. And the next question I'll bring forward does feel like commissioners can speak, several commissioners can speak to this. So can we discuss a little about the resource support that people can receive if they are positive for COVID-19 or have an exposure to COVID-19 and they need help with rent, electricity, gas, water, food, etc. The subject matter expert response is when someone tests positive or has been exposed, we ask them about what supports they need to assure access to food, rental, housing costs, utilities, etc. We work with our local community-based organizations and public health staff to support families' essential needs.
Commissioners, we've been hearing about this from our staff in our meetings every week, just about. Are there some stories, some experiences that you would like to share with our community about that? Go ahead, just jump right in. Go ahead, Commissioner Treese.
Thank you, Chair. I think that one of the things that I am very impressed with in our staff, one of the many things, but is how our public health staff they have such huge hearts, not just about about the work that they do and about being public servants, that the stories are many, and they started way back in March about providing support to our communities, the people that can't get out for groceries, the people that need help getting to doctors, the people that need any additional support, answers to questions about how to take care of a loved one who's ill. So I just want to take this opportunity to throw out to the community at large the knowledge that our health and human services staff and the support to our community is excellent. They care a great deal, and they're working very hard to make sure our community is supported. I don't remember, Chair, the numbers in terms of how many families are being supported directly. I'm sure Martin and Kyle can give us that information, but it's not just in terms of dollars and cents. It's also in terms of emotional support, behavioral health advice, those types of things as well.
Thank you, Commissioner Treese. Go right ahead, Chair Harrington.
Would it be possible for one of our staff who's driving the system to bring up a shared window that goes to our county website, co.washington.or.us, and then click right on the COVID-19 graphical button? Our team over these months, they just recently redesigned the website because over these many months, they have put together a lot of good resources for you. So if we could just show you that main COVID-19 page, and once again, I got there by co.washington.or.us and hit the COVID button. So you can see here that there's information about if you've looking to get tested, once you've been tested, there's information if you have a member of your household that is sick, or if you need help. There on these different pages, there are ways to get help with mental health. The state started a website, safeandsound.org, to help ensure that people could connect with more services, including for mental health. So there are various resources for you to reach out to. 211, if you dial 211 on the telephone, that is also another resource to get you connected. Here in our community, one of our partners, Community Action, has been working with a lot of families. Our own public health staff has been making sure that people who need help, as mentioned, with groceries and connecting up with pharmacies, have those resources. They've been supporting upwards of 200 to 300 families per week to make sure that people's basic needs are being met. And that's in addition to what our community-based organizations, our churches, Adelante Mujeres, Centro Cultural, Apano, many others, Meals on Wheels, you name it, IRCA. We've been working with all of them to try and get support to our most vulnerable community members. We're grateful not only for the dedication and passion of our Washington County staff, but also that of our community-based organizations. Thank you.
Thank you, Commissioner. And I think it's important to note, even on that website, there were Spanish language pages as well. And for the pages that don't have the language interpretation readily on the website, people can still contact the county and find out information through healthcare contacts that will speak that language to them. So a lot of residents would rely upon that. So thank you for giving us a very good real-time, this is what it looks like, this is how to navigate it. That was excellent. I will do a time check, not to scare anybody, but we have about an hour. I just wanted people to know we have about an hour left, so there is time to get your questions in, to raise your hands, and I will check back with Elizabeth at this point for the next question, but I just want people to know we're doing well on time, and your commissioners who want to have this town hall maybe a year from now about post-COVID-19 stuff, they really want you to listen and ask all the key questions that are on your mind. If it's on your mind, it is probably on several other people's minds that is on this call. So you will be helping all of us by lifting up your question. Elizabeth?
Yes, thank you, Marcus. We do have several questions still going strong here. So let me just pull one up. There's been questions about who is paying for the vaccine. And I want to make sure that I ask the question correctly and get you the correct answer. Do you happen to know if we will pay for the vaccine or if the feds will cover the expense? The federal government has purchased vaccine. There will be no cost for the vaccine, but providers may have a cost for office visit and any other care provided. So that's a question that's come up several times. There's also been a question about whether, I'm sorry, let me pause it. I don't know if the board wants to. Okay.
Well, I think just as people have seen us have free test clinics, they can expect that there will be free clinics to get the vaccine. So it's just, we don't want any of these precious vaccinations to go to waste, but we also want to make sure that they get deployed to our most vulnerable communities as quickly as possible. So it, unfortunately, in these very early days, it's a little complicated.
Thank you, Commissioner.
Great. Well, another question that's come in is about whether we expect there to be another round of federal stimulus dollars. And I'll take part of that question, which is, it does look like the current negotiations in Washington, D.C. have broken down. It is hard to see if something could happen between now and the end of the year. Our colleagues in the federal delegation are aware of the needs of the community, and I know I've been working hard. I've heard that there will be a deal in the new year. I don't know if we know what that's going to look like, but I certainly turn it over to the electeds to speak more to that.
Well,
Hard
unfortunately,
to say right now.
yeah, it's really frustrating. You know, we know that our community is hurting, more resources are needed. You know, we need to see the logjam broken.
And I'd add, as Elizabeth mentioned, our federal delegation, Senator Wyden, Representative Bonamici or Congresswoman Bonamici, everyone is very well aware of what our needs are here, and they're working hard in DC to come to some sort of agreement. Thank you.
Good. Thank you, commissioners. Thank you, Chair. Elizabeth, you can keep working down that list that you have. And also, I know you're getting things real time in the Q&A.
Marcus, there are some raised hands now.
Oh, excellent. I think the commissioners would appreciate hearing the voices of Washington County. So could you elevate one, Marcus, please?
Yes, so I'll go ahead and start with Joe. Their hand has been raised for a while. So Joe, you can, oops, wrong button.
Welcome, Joe, whenever one of the Marcuses gets this straight.
So it says Joe is using an older version of Zoom and needs to be promoted to panelist to allow to talk. And unfortunately, we can't do that. So if you can type your question into the chat, Joe, that would be great. And I'll move on to the next raised hand, which is Dale. And Dale, you can unmute yourself.
Can you hear me now?
Yes, welcome.
Am I unmuted? Thank you. I'm Dale Feek again. Question is, how can people easily get on the county webpage so they can listen to the weekly work sessions? And I think those are video too, and they're recorded. So how can they do that? And also, how can people easily get on the Zoom link to listen and watch to the county commission meetings, and also make public comment for the 2 minutes at the beginning of the county commission and or 5 minutes at the end of the meeting? Because Marty Kyle makes excellent comments at the meeting, and sometimes people would want to do 5 minutes at the end of the meeting. So how can people easily do that?
So this is Chair Harrington. I would ask our staff for a little bit of display help here. if you could share the county website, co.washington.or.us for us, please. Thank you, Marcus Ford. Then if you go over to the left-hand side, the menu, pick Board of Commissioners. Then go under Board Meetings, Board Meeting Schedule. These are our most recent upcoming meetings. So if you scroll down the page a little bit, you can see there's the Zoom information for today's meeting. And then on Tuesday, December 15th, you can see there is the Zoom link. There's the link for our work session packet. There's the Zoom link for that meeting. Then we have a board meeting that starts at 6:30 in the evening. There's the packet for that. And then there's the link to join that meeting. If you look at the packet, if you were to click on the packet, and I don't suggest we do it now, but you would see the full agenda. Now at the top of this page, it talks about being able to testify at the meeting. So you can register in advance so that our board clerk, Kevin Moss, to call on you. If you don't have Zoom or don't want to watch it on Zoom, you can also see it on YouTube. And if you go to the Washington County YouTube channel, if you just click on that link, it'll take you to a page in YouTube and you'll see recordings of all of our various meetings. So there have been meetings where I've gone back and watched that YouTube in order to watch once again our Health and Human Services Director, Marnie Kyle, and the presentations that she has made along with the expert epidemiologist and our public health director, Tricia Mortel, have been sharing with us every single week during the course of this pandemic. So that menu path is the one that I use every week to get our packets. If you're interested in signing up, yes, there are different ways to get to it. If you're interested in receiving email notification of our packets each week, you can sign up to get that email. That is how I get to our packets as well, to review the packets ahead of time so that, like my colleagues, we are prepared going into those meetings. I hope that helps. Thank you.
And just one thing, Dale, I'm quite sure, I would imagine anyway, that the county staff is always welcome for ways to make access to their website and to things that interest the community better on their website. So anytime anybody has a suggestion about what would make it better, if you send it to the county team and the county staff or the county webmaster, I don't know who owns that box of work, but they will, I am sure, take that into consideration and try to make it as user-friendly for the residents as they can. So, all right, Marcus, did you have anyone else with their hand raised?
I do. Hector has their hand raised, and Hector, you can unmute yourself and ask your question.
Welcome.
Hi, Hector Hinojosa here again, Marcus. Thank you so much.
Yes, sir.
My concern and what I'd like to solicit all of your help is a sense of urgency in the new CDC demographics regarding the death rate for folks of color, particularly as it relates to the Latino community. We're at about 2.8 times higher death rate than anybody else. Let me say that again, 2.8 times higher death rate than any other group. So as it relates to the vaccine, my question, concern, or soliciting your advocacy is, do we move up the list for vaccinating? I understand the importance of vaccination as a preventive initiative, but we also need to close up the back door. And we, when you have 2.8% higher death rate than any other group, perhaps we should be focusing some energy or vaccination at that level as well. So I don't know if it's a question or comment, but I am soliciting your help, a sense of urgency to address the 2-point death rate, higher rate among people of color than any other group. Thank you.
Hi, this is Chair Harrington. I do have some information to share there, but I wanted to first see if my colleagues wanted to go first. So I'll just share that in a meeting with state officials yesterday, I am aware, well, in two things that happened with the state yesterday. So the governor has just appointed a new head of the vaccine deployment. I also learned through the OHA medical expert Don Mottner yesterday that the state is forming a vaccine advisory committee to work through all the details. And that committee is being pulled together now, and OHA has received 500 applications from experts here in our state from all sectors. But I also learned about the health equity lens that the state is going to be using. So I want to assure you, Mr. Hinosa, that the state is prioritizing the distribution of this vaccine to our most vulnerable, including our historically underserved and disadvantaged community members. In addition, they want to make sure that the vaccine is available, accessible, that folks are comfortable in providing informed consent, and that there is information to each of our residents of different cultures and different languages in a language and culturally appropriate way. These experts reassure us that they are very aware that different communities relate to vaccinations and government differently than folks of my background, for example, a person of white privilege. I recognize that I am. So the state is trying to make sure that through this phase 1 plan and into phase 2, that they are targeting our multicultural community members who have been disproportionately affected by this terrible virus. The proof is in the pudding still, since deployment hasn't actually happened. So I can understand where it just feels like a lot of words right now, Hector. I get that. But they are putting together the plans, and action starts tomorrow, right? Sunday, when the vaccine leaves the manufacturers. So I remain hopeful, and it's one reason why I expect I'll be one of the last people to be vaccinated because of there are more important people to be vaccinated first. Thank you for your question.
Chair Harrington, I see some of your other commissioners had unmuted. I wanted to make sure that they got the floor.
What I would simply add is that as we look at the 1B category and look at the critical workers who are in places of exposure, that would address at least some of our Latinx community who are disproportionately represented in occupations where there's a great deal of exposure. So I hope and believe, and I think appropriately so, that as we look at 1B, get past the healthcare frontline workers, that we will seriously address that very disproportionate impact to the Latinx community. And beyond that, just speaking in my own personal view, there was recent legislation that called out for health insurance and healthcare as a human right. I really believe that's true. And we as a nation, as a state, and as a county need to make sure that we all get the kind of basic preventative care, and that we can be in a position where we can help people make good basic healthcare, lifestyle choices to be healthier, so that we can truly lower the number of people who have underlying conditions, which expose them very topically with COVID, but it's also a problem with respect to other diseases and problems. So as a nation going forward, we need to do a better job to make sure that everyone leads a healthier lifestyle, gets ongoing preventative care, annual checkups and things like that, so that we have a much lower percentage of our population having these kind of underlying conditions that have made them susceptible to COVID, but frankly to other things in the past and going forward as well. Thank you.
Thank you, Commissioner. Commissioners?
I would just like to add one quick thing. While I support everything that both the chair and Commissioner Scouten have said, that it's unacceptable to have this type of disparity. Hector, I want you to know, in my view as well, the takeaway, if you will, from a disaster like this is what exposures have we come to understand in our community about our vulnerabilities. And I think that as we work forward, as I work forward here, this underscores just how important it is to address all members of our vulnerable communities, but primarily in Washington County, our Latinx community. I sit on the board of Centro Cultural, and it gives me an opportunity to have an inside view in relationship to the communications with support to the Latinx community. And I work very hard to take that back to the commission. All the commissioners approach these issues this way, but I do thank you for your input.
Thank you all. I believe Elizabeth has a question ready to go. Elizabeth?
I do. Apologies there. So a question about runners and cyclists on THPRD trails. The vast majority do not wear masks, yet stay right on the trail. Is there any way to address this? I know Commissioner Treese, I know we got a couple cyclists on this, but I'll send this over to Commissioner Treese. We are encouraging everyone to wear face coverings whenever you are not at home, including outdoors. However, the greatest risk of exposure is contact with someone within 6 feet for 15 minutes or more. So Commissioner Treese, I know I've seen pictures of you cycling lately, so.
Well, thank you, Elizabeth. I want you to know that in September I was cycling and I fell and broke my collarbone, but I had my mask in my pocket so I could quickly put it on to make sure everybody was safe. I think that it's important to realize a couple things here. Number one, what Elizabeth said about exposure factors and being close to one another for an extended period of time is important. I think it's also really important to remember that mental health is such an important part of what we're going through during this time. So being outside, exercising, making sure that we're practicing social distance, keeping a mask with you if you're running or cycling, so that if you're in a situation where you stop or you have interaction with people, you can quickly put it on, I think is really important. There are new types of masks out that you can wear around your neck that offer protection, not, and that's what's important here, is making sure that the protection is available there that can just slip over your face. So I would encourage all of us to get outside, enjoy days like today, be healthy, do everything you can to keep your mental health, but at the same time, keep your eye on protecting each other, protecting others and yourself.
I don't have much to add. I do my share of bicycling. I think the Commissioner Chiefs handled that question pretty well. Pretty much having a mask with you, whatever you do, whether it's getting in a car, walking, biking, or whatever, it's like your car keys. It's like your wallet. You pretty much you need to have that with you at all times now, and that'll be true for some number of months yet. So yeah, I always have a mask with me when I'm biking, and I'm ready to put it on as soon as there's any possibility of being anywhere close to someone.
Thank you, Commissioner. Next question, Elizabeth. Thank you.
Sure, yeah. So this question came in a little while ago, so I'm glad we have a minute to get to it. Why is it so hard to get a test and test results in a timely manner? Some people are trying to be responsible and get tested before seeing people, but when the results take 3 to 5 days, the test becomes basically worthless. Is there going to be a better strategy for tests with better access and quicker results? So I'll start again with our subject matter expert response. As we have seen a second and higher spike in COVID infections within the community, testing needs have outpaced our testing capacity in the healthcare system. We are hoping that newer rapid testing will become more available and more reliable so we can use these more often in the coming months.
Is there any indication of when that comes, how the county would share that information? Would it, again, all be on the website as new information comes in, you're updating it whenever you can?
Well, for us, Marcus, that's all of the testing is done through private labs, and it's like anything else, supply and demand. What we all had the opportunity to learn from was the amount of testing that really spiked before the Thanksgiving holiday, because there were a lot of folks that wanted to travel. There were also college students that needed to return from school for the remainder of the semester. So there was a great deal of demand. We don't have any control of that. We are able to have clinics to provide testing, but we do not control how long it will take for those tests to be processed and the results being available.